Just going to share my screen here with you all. All right, can you see the full picture now?
It's there.
Thank you. All right, so hi everyone, my name is Kaitlyn. I am the Regional Prevention Partnership Coordinator through Rutland Regional Medical Center. I'm working on a substance use prevention grant focusing on alcohol and cannabis use in youth and young adults. And I am co-presenting with Sarah Roy, and I'm gonna let you introduce yourself, Sarah.
Hi everyone, Sarah Roy. I work for the Department of Health doing substance use prevention here in Rutland through alcohol and drug abuse programs. And we're excited to offer you the Prevention 101. Thanks for coming.
Yes, thank you. All right, so first off, I would love if you all we could go around quickly and just say your name and what organization, school, or community group you're representing. And then keep in the back of your mind, what does prevention mean to you? So Michelle and Stephanie, do you want to go first?
I'm Michelle Hoffman. I'm one of the inpatient social workers on the psychiatric unit at Rutland Regional.
Hi, I'm Stephanie Quenneville. I'm also a social worker on the inpatient psych services.
Thanks. Betty?
Betty Hughes, school counselor, Elm Street campus. Sorry.
Thank you. Stephanie.
So I'm Stephanie Roach. I'm a wellness coach at Rutland Regional with multi-specialty clinics.
And then, I'm sorry, I'm going off of memory, I believe. Is it Mary?
Yeah, I'm Mary Faenza. I'm the program coordinator at Black River Area Community Coalition.
Awesome. Thanks. Did I miss anybody? No? All right. So again, keep in the back of your mind, what does prevention mean to you? So this is a little bit of an overview of what we're going to go over today. So we're going to start out with just a quick little pretest on knowledge. We're going to talk about prevention and why it's important, some risk and protective factors, brain development, and then ways that you can help. And then of course, we'll leave time at the end to answer any questions that you all might have. So we're going to start off with a little pretest poll. So Sarah Cosgrove is running IT for us today. So she's going to go ahead and launch that poll. Awesome. All right. You can go ahead and share those results, Sarah. All right. So it looks like we have a little bit of a mix of familiarity with prevention, but I'm happy to see that you all wrote that prevention is very important. So we're going to go into hopefully making you more familiar with prevention strategies so that you're all more on the higher end of that knowledge by the end. All right, so I am going to kick it over to Sarah Roy, who's going to talk about some prevention tactics.
Thanks, Kaitlyn. You can go right into the next slide. So these are why we do prevention. So how prevention works is that preventing substance misuse reduces the risk that contributes to alcohol, tobacco, or other drug use, while promoting protective factors that support healthy lifestyles and communities. By stopping substance use before it starts or before it becomes substance misuse, prevention works to save Vermont tax dollars. So the top one is about that. We know that for evidence-based school prevention programs, we can save Vermont $18 for every dollar invested. And same thing with a dollar invested in an evidence-based program that supports strong family connections combined with school prevention, we can save between $3 and $11. So money is a big piece to it, but we also know that if we delay the onset for our youth to not start using before the age of 21, they're 5 times less likely to use substances or have a substance use disorder later in life. Impacts on other areas of life as well. So from school to community to family, this is why we want to have a blended approach and lifelong knowledge. We don't want our young adults starting substances when their brains are still forming and trying to make those connections. We want to make sure that their brains have the ability to fully form and not worry about anything impacting them. Next slide, please. So when we think about prevention, we use this nice continuum of care to show where everything falls in. So this model was first presented by the Institute of Medicine in 1994 as the mental health intervention spectrum, and it was expanded in 2009 to include promotion. As you can see, promotion runs the bottom. The continuum of care describes the scope of behavioral health services for individuals before, during, and after they experience a behavioral health problem, including promotion, prevention, treatment, and maintenance. Maintenance used to be called recovery, but they changed the terminology. So the continuum segments the need for care and the type of care required for various parts of the healthcare system. The continuum underscores the interrelationship among promotion, prevention, treatment, and maintenance. So if we think about promotion, which is running along the bottom, does anybody have any idea of a promotion campaign that they've heard locally? So promotion would be crossing over to everyone and not targeted at one specific population. And feel free if you want to just say it out loud or pop it into the chat. Is anyone familiar with the Rutland Rex slogan? Oh, go ahead, Stephanie. I see you unmuted.
Oh, I was trying to find my little chat thing and I couldn't figure it out. You know, one thing that popped into mind, although I'm not sure if it really captures everything, is something like Turning Point. I know they have a lot of different programs. I think some aimed at kind of prevention, community awareness, supporting people through kind of treatment and maintenance. So.
That's great. That is a wonderful one that goes full spectrum. So people think Turning Point only in the maintenance recovery side, but they are actually doing everything from promotion all the way through. It's a great example. Thank you. Anyone else? I'll just highlight a good promotion campaign too. Again, it's ones that are very broad base. So Rutland Rex Go Play is a promotion campaign. So it doesn't have any population or age involved in it, and it's anybody could relate to that. So the Go Play piece to it. We also have Rise Vermont, which looks at like healthy behaviors. They talk a lot about just getting out there and doing things. And when we look at that in the promotion side, so societal, community, individual, and family, those are different areas that we can touch on when we're talking about promotion. When we jump to prevention, there's 3 different areas that we look at. So as you can see in the top of the fan, it says universal, selected, and indicated. So universal prevention is the broadest approach and focuses on the general public or whole population that has not been identified on the basis of risk. So universal prevention interventions might be in schools, communities, or workplaces. For selective prevention, that's for individuals or a population whose risk of developing mental disorders or substance use disorders is significantly higher than average. So they focus on biological, psychological, or social risk factors that are more prominent among high-risk groups than among the wider population. And then it gets even smaller when we think about our indicated. So those are for high-risk individuals who have identified as having minimal but detectable signs or symptoms foreshadowing mental, emotional, or behavioral disorder. These interventions focus on immediate risk and protective factors present in the environment surrounding the individuals. So what we're trying to do is talk promotion across the whole continuum And then when we get into prevention, we're really divvying it up into those 3 areas of what can we give that's a universal across everyone and to help mitigate the risk. And then those who are at risk and largely at risk in the indicated side before we need to go into the treatment section of it. Next slide, please. So because we are Vermont and we like to be our way of doing things, we adapted the socio-ecological model and made it the Vermont prevention model. So this shows how a variety of prevention strategies at different levels can be used to get together to get best results for Vermonters. The model suggests that behavior is influenced by a variety of different things and is best to try and address across the spectrum. So to walk through this, an example of how a community or state might address alcohol misuse in a comprehensive way, we'll think about reducing underage drinking. So if we looked at the individual level, which is on the bottom, talking about knowledge and attitudes, we're looking at changing knowledge, attitudes, and beliefs. By changing social norms, we can change the attitudes around drinking. What we mean about social norms is that we do the youth risk behavior survey every other year on the odd years in our state. And we ask students about their perception versus reality. And we know that they overinflate their fellow students' use. And that is how we change the norms around that. So we actually know what the real numbers are and we know what they think they are. So we look at that norms piece to it. At the relationship level, which is the next one up, we want to affect family, peers, and social networks. So a family education program would be a great intervention that would happen here. We've done strong families in Rutland County, so that brings families and their young adults together to really work on that family connection. Something at the organizational level, it would be a mentoring program. So something that would give our youth and young adults access to another adult that they can trust. And we know that's a huge protective factor. At the community level, we can change the physical, social, and cultural environment. So limiting outlet density changes and physical environment. A lot of places around Vermont look at the density of our places that serve and sell alcohol in our communities to see if we have ways that we can approach that so we don't have as much in our socioeconomically diverse relationship to different communities. So we don't want to have more access to alcohol in certain neighborhoods than others, but we just want to look at that piece to it as well. And finally, when you look at policies and systems, which is the biggest one and sometimes the hardest to get to, changes in laws and policies, so such as instituting a legal minimum drinking age, which is what we have in our state. So this slide just brings those pieces together and it shows you how they fit into each of the different areas of the prevention model. So it's a comprehensive approach, and that's the biggest thing, that we want to work together across all of them instead of just one of them individually. So hearing what everybody's come to this training with, you bring all from your organizations, you could all work together and affect change when we look at it this way. Next slide, please. With the Substance Abuse and Mental Health Services Administration, they address the 6 strategies for substance abuse prevention. And I want to note here that the word abuse is present, and a lot of our language has changed from abuse to misuse, but this one still says abuse in their title. And the reason we're using misuse is around stigma. So we don't want people to think that the abuse is a negative connotation, so it can be misuse. These 6 areas, so from the top left, information dissemination, I already talked about that, media campaigns, social media, community forums. We look at prevention education, so curriculums in our schools, anything that people can attend. Positive alternatives, so for our third space is a big piece that people might have heard around our community around the state. So that piece to it, what is available for other people to do. Environmental strategies, so talking about outlet density, stronger enforcement. There was a great piece about highway traffic safety in the paper, and that's that same part to it. So looking at the enforcement and community-based process. So organizing and planning together the Partners for Prevention, which Kaitlyn and myself and Sarah Cosgrove were involved in. It's bringing the community together to have that same messaging around what we're doing on prevention. and identifying a problem and referrals. So what I'm hearing, some of you work in that field to it too. So screening and referring those who need service to service so they can get it sooner. Next slide, please. We also build on the strategic prevention framework. So as you can see, this is in the shape of, we call it either a pinwheel or a flower, and it's constantly what we're assessing and how we're looking at the work that we do on prevention. So we start at the top and looking at assessment. So one, figuring out what we're doing, how it applies, then looking at the capacity. Do we have enough people, bodies, money to do what we want? Planning out our strategies, implementing, and then evaluating. In the center of it is sustainability and cultural competency. We always want to think about how we're going to keep the work moving if it's only for limited funding, and are we really owning the culture of our community that we're working with. So it's the phrase that we like to say is nothing about us without us. If we're focusing on youth, we want the youth voice there. We're not of that age. We want to make sure that we're understanding the youth piece to it. This framework is probably something that most of us have used in a daily basis. If you think about just going to the grocery store, you're going to do all these pieces every time you go there, but you might not think of it as a strategic prevention framework. If you're planning a birthday party, the same thing. So we walk through all these steps. Some people even say, like, buying a car, you're assessing what you want, you're going to figure out how much money you have, you're going to plan when to go, you're going to buy a car and wonder, was that the right move for you? So evaluating it at the end. So this is just another tool that we have to make sure that we're following this frame in order to keep our prevention work moving forward. So I've alluded to risk and protective factors already in the last section. So the biggest one to know is that back in the 80s, Doctors Hawkins and Catalano at the University of Washington compiled risk and protective factors for substance abuse and other problems occurring in adolescence. Some people might have heard of the 40 developmental assets. So those are pieces that we talk about and how they relate to substance use and helping our youth develop in a positive way. Next slide. So risk and protective factors, and you can keep clicking on this one, Kaitlyn. So our protective factors are associated with lower likelihood of developing a problem, and the risk is the counter. So it's associated with a higher likelihood of developing a problem. Risk factors must precede the problem in order for that. And the protective factors is newer research, but there's been a lot that's been identified with it. So prevention programs are designed to enhance protective factors while reducing the risk factors. You can think of risk and protective factors as working against each other, but it's important that they are not a one-on-one. So one really strong protective factor may be able to work against several risk factors, for example. And we know that there's many ways that we can mitigate these risk and protective factors, which we talked about previously with the strategies and looking at our framework. But we've also, on the next slide, identified some risks with the highest correlation for youth substance use. Peers are a huge influence on our youth and young adults. So friends who engage in the problem behavior have favorable attitudes toward it. When it comes to family member has a history of alcohol, tobacco, or other drug use. So that's the genetic component, or parental attitudes and involvement in drug use. For our schools, we're talking about the kids who are early and persistent antisocial behavior, lack of commitment to school, and community. So alcohol and drugs readily available, and community laws and norms are favorable to drug use. We have conundrums in our state when it comes to cannabis, especially with commercial cannabis happening in our state in the upcoming years, and how that works with what Kaitlyn is funded to do on cannabis prevention. So it's that seeing it and how it really interplays with our youth and what they understand. We know a big piece. Oh, I'll talk to that on the positive side. I was getting ahead of myself. Next slide, please. We also know, and a lot of newer research in the last decade around adverse childhood experiences. So ACEs is a term, it's an acronym, And it was originated in a study in 1995 by the Centers for Disease Control and Kaiser Permanente Health in California. And it refers to 3 specific kinds of adversity children face in the home environment, from physical and emotional abuse, neglect, and household dysfunction. So how common are ACEs? The key findings of dozens of studies using the original ACE data they're found that they're quite common even among middle-class population. So more than 2/3 of the populations have been studied report experiencing at least one ACE, and nearly a quarter have experienced 3 or more. So what do they tell us? There's a powerful persistent correlation between the more ACEs experienced and the greater the chance of poor outcomes later in life, including dramatically increased risk of heart disease, diabetes, obesity, depression, substance use, smoking, poor academic achievement, time out of work, and early death. We bring this up because it's more and more that we're seeing the connection between ACEs and substance use and just ACEs in general health. And we want to make sure that we're sharing this information with people. I'm not the expert on it, but this is a lot of good information that you can find from the Centers for Disease Control. This slide came from them, and it's just showing that their early adversity has lasting impacts, but it's also, again, not one that can't be changed either. There's a powerful and persistent correlation between the more ACEs experienced and the greater the chance of the outcome. So it's just to remember that piece to it. And there's I believe the movie Paper Tigers talks about this, the connection between ACEs and people's health and in how they develop. Next slide, please. So, and I don't want to, everything is not a risk in adolescence. So we do have things that are great and protective factors for our youth and our young adults. So positive development, so kids that are giving opportunities to really explore, families with appropriate structure and opportunities to belong, and positive social norms. The biggest prevention that we know is that a family that talks to their youth and young adults and even just expresses their feelings around substance use, that they disapprove of use, is a great preventative tool. Schools that are physically safe and have great structure and supportive relationships. One trusting adult in a child's life can lead to a huge protective factor. In the community, youth feeling that they belong and that they're part of the community and they have a voice, which is all the great work that's happening with the Vermont Youth Project to really get our community to see that we have youth and young adult here that are value and not just a token in our community. So giving that piece and voice to them, and integration of the family, school, and community efforts. So really blending it all together, opening up our schools for kids to be able to use after hours, making the school family connection a bigger connection in our community. So are all great positive examples. And positive bonding can make up for many risk factors. Bonding is deeper than spending time together. So it's just that bigger connections. And I'm set.
Thanks, Sarah. I appreciate it. So now we're going to move into some basics of brain development. So I'm going to ask Cosgrove, we have another poll just to kind of gauge where you're at with at what age we consider the brain to be fully developed. Awesome. So we have all of our answers in. Y'all are right on target. It is in your mid-20s. So I guess there's no more knowledge to be gained in that area. Y'all are rock stars. All right, so we have a quick video that we'd like to show. Let me know if you can't hear it. Maybe if it loads.
As teens,
I guess I can't mute myself.
people are always telling us we can't do. Do you ever wonder why that is? Why can't I stay up late? What could happen if I just play for 15 more minutes? Who cares if I smoke a joint every now and then? Let's face it, adults may mean well, but they can't really explain why they won't let us do this stuff. The thing is, there's actually a really cool explanation, and it has to do with our brains. From the outside, the brain of a newborn looks just like a smaller version of an adult brain, but there's a big difference. There's a ton of stuff that still needs to be programmed into a young person's brain. That's where our life experiences come in. How we interact with what's around us shapes our brains until we're in our mid-20s. We can't feel our brains changing, but they are super busy building circuits and programming. So how does this happen? Every little thing that happens to us can change our brain in huge ways. At short distances, our experiences can make or break connections between brain cells. By guiding the creation of circuits, experiences shape our perceptions, memories, and everything that makes us unique. But they also affect our brain across longer distances. This involves the construction of thick bundles of fibers that connect different brain regions. By creating this complex network, experiences help increase the brain's bandwidth, allowing it to work better and better. But you gotta keep in mind, these short and long-range connections are influenced by everything we do and everything that happens to us. But this is awesome news. It means we are the programmers of our brains. Every decision, good or bad, influences how our brain develops. Let's talk about taking drugs. For example, pretend this is the keyboard you are using to program your brain. Using drugs just for fun or to get high would be like scrambling the letters on the keyboard. Now, if you scramble the letters on the keyboard after the program is written, that can lead to temporary errors or make it hard for the program to run for a while. But if you scramble the letters while the program is being written, the program can incorporate catastrophic, long-lasting glitches. This is why teens are better off without drugs. We are in the middle of coding our brains, and drugs can cause real problems that can last a long time. And yet, drugs are just one of the many possible ways of scrambling our keyboards. For example, not enough sleep, lack of exercise, or eating too much junk food can also harm our brain programs. So yeah, I get it. It's annoying to be told what we can and can't do, but I would rather focus on my ability to shape my brain through smarter decisions. It turns out we have far more control than we thought. We can use this information to choose our own paths and give ourselves the best possible futures.
So I really like that video just because it gives a great example of, the impact delaying onset of substance use can have of, switching some letters on the keyboard after the program's written versus before. And so as we said, the brain isn't fully developed until about the mid-20s, around age 25. And the brain actually develops from the back to the front. So starting at the cerebellum there, that's impacts your balance, muscle control, and coordination. Your occipital lobe in the green has to do with your vision, seeing color and light. The parietal lobe, which is blue, has to do with your senses, attention, and language. And then that big yellow section, the frontal lobe, is the last part of your brain to develop. And that has to do with your personality, decision-making, reasoning. And so again, delaying onset of substance use is super important because that section of your brain isn't fully developed. And so you're most likely not to make the best decisions because you don't have all the information in front of you. So if you could write in the chat box or unmute yourself and just say some behaviors that come to mind when you're talking about adolescent behavior. And Sarah Roy, if you could read those out because I can't see the chat.
Moodiness. Risk-taking behaviors.
Yep.
Impulsiveness.
Impulsive. Testing limits.
Definitely. So those are definitely all right on track with what some of the research says, and actually Spear did some research on adolescent brain. And so it's important to note that, as Sarah said before, youth will spend more time with friends. They tend to pull away more from their family. And it's important that they have those relationships with their peers so that they can kind of learn those worldviews. But again, it's important that we support it in a healthy way. Same with risk-taking activities and risky behavior. Risky behavior can, again, be a positive thing, but in a controlled manner. And so we want to support, if one example would be if someone wants to kind of step out of their comfort zone and try out for a play, that's a healthy risk-taking behavior. So we want to promote those opportunities and kind of set the stage for supported risky behaviors. They're also, like the video said, more likely to have sleeping pattern changes and more conflict with family. So over time, and given all the changes that are happening in the brain and the development and that last frontal lobe being the last part that develops, when individuals are using substances, they'll need to use more and more to get that same high. And so we call that, they run the risk of having a substance use disorder. And so when they have a substance use disorder, they become dependent on that all the time. So we don't have to think about it necessarily in terms of alcohol or drugs. One example that everybody can kind of relate to usually is sugar. So if you've ever tried cutting sugar out of your diet, you can become cranky and moody and just headaches and feel kind of like icky and stuff. So that's one way to kind of think of that, is that when people try to remove that substance out of their system, it kind of reinforces the need to use. So obviously we've given you a lot of risk factors and things to look out for, but we also want to support ways that you can help and things that you can look out for. So ways to start or to support prevention are definitely to start those conversations early. Again, Sarah mentioned kind of setting the stage that youth are more likely to not use if they know their parents' expectations regarding substances such as alcohol or cannabis. So we would definitely recommend, even though it's uncomfortable, you have those conversations early, share your expectations on substance use. If you do have kids in the house or anybody, really, you should keep your substances locked up. Alcohol even goes with prescription medication, keep them out of reach of kids, pets, all of that. We have a ton of great resources in the area as far as resources. There's parentupvt.org, which has a ton of conversation topics and tips to help you have those discussions with your kids. And then we also have year-round disposal boxes for prescription drugs, and definitely plenty of resources to hand out. And again, we want to create and support healthy risk-taking opportunities, so making the space for that. It's definitely not the only options to support prevention. There's definitely plenty more. And as Sarah has discussed earlier, again, SAMHSA.org, the state of Vermont website, and we have a Partners for Prevention website as well. So all of those will be at the end. So here we just want to do, again, a quick knowledge check. So if Cosgrove, you could launch the poll. Awesome. So it looks like we have moved most of you into that very or extremely category for knowledge base. So definitely happy, myself, Sarah Cosgrove, or Sarah Roy are happy to answer any questions you might have or point you to resources. So I'm going to open it up now to, any questions you all might have.
I don't have any, but thank you guys very much.
Thank you all. Again, if you think of any questions, don't hesitate to reach out to us. I am going to put our contact information on the screen really quickly. And then that way.
And is there any way that maybe you could share the slides or the PowerPoint with us?
Yeah, we can, I can definitely share this recording as well. And then we were talking about, I believe, Sarah, right? Doing something with the slides. So we can definitely get those to you later as well. So again, if you have any questions, you can reach out to myself or Sarah Roy. Email is probably the best way. Awesome. Any other questions that we can help you with before we end? Yeah, and Sarah put my email in the chat as well. Thank you, Sarah. All right, well, thank you all for coming. I appreciate it. And I hope you have a great rest of your day. And I will be sending out just a quick evaluation form after so that you can give us some feedback as well.
Thank you.
Thank you.
Thanks.
Thank you.
Bye.
Bye.
All right, nice job.